Time and...
What's up, everyone? My name is Dr. Brent. I'm a chiropractor in Illinois, and by popular demand, I'm going to react to the show Crack Addicts on TLC. Okay, now let's get started.
My left side on her is sitting about 1.5 inches higher than the right side of her pelvis. And you're kind of almost shifted, like you're rotated anteriorly on this side as well. This is where your bone is sitting right now.
Okay, so what she is checking for is the position of her pelvis. So this is good. She's checking what she's going to adjust before she adjusts anything. So what you see, her left thumb is sitting higher, and it's sitting more posterior or backwards on her left side. What that means is the left side of her pelvis is rotated back and the right side is rotated forwards. This is super common in what I'm seeing in clinic. It leads to a lot of low back pain, some pain, numbness, tingling, shooting down the legs. So far, pretty accurate.
This is where your bone is sitting right now. The sacrum is that triangular part, right? And it's controlled by the pelvis. So we can go superior, inferior, anterior, posterior. And hers was really rocked superior and anterior like that. I'm thinking, okay, that can't be good. That would definitely pinch a nerve. That could definitely decrease signals and create digestive issues.
So she says pinch a nerve, right? We use a big fancy word in chiropractic called subluxation. And that's when a bone is out of place and it's putting pressure on a nerve. When you get pressure on a nerve, you get two things that happen. You get pain, and you get loss of function.
So guess what? You're here because all the farting and tooting, but I actually think you're gonna walk out with a little bit more than that, okay?
Now this is, her main complaint is she's here because she's farting and tooting. Can't say I've ever had that as a main complaint coming to the clinic. Does it come up in practice? Like, yeah, you know, I've been farting a little bit more. Yeah, but for a main complaint, no, that does not come into the clinic as the priority.
His sacrum is super rotated. By adjusting the sacrum, we're really hoping to increase function and turn off the gases. No, we're going all the way down.
All the way down?
All the way down, girl.
Okay.
You gonna do me a favor?
So you may be asking yourself right now, is like, okay, so her problem's in the low back. Why is she treating the neck? A lot of times as chiropractors, we treat the whole spine. Reason is you got your brain, you got your spinal cord, you got all the nerves that come off the cord at all levels. If there's subluxations in any of these areas, it can be causing problems in different parts of your body. So a lot of times, especially myself, I like to clear out the whole spine, check the whole spine for subluxations, and fix what's there.
And I want you to just wiggle that right toe. Wiggle it.
Oh my God, that was the best thing ever! Oh my God! Like, I was a little bit in shock. I just didn't know that my back was like that.
And what I was going for here.
Oh! Oof.
Love it.
So patient, okay. We see so many different types of patient reactions to adjustments. We see screaming like that. We see dead silence. We see laughing. That's pretty accurate. That's pretty common.
And what I was going for here.
Oh! Oof.
Love it. I want you to look up to the ceiling for me. Big breath. Oh. Let it out. Let it out. Let it out. Let it out. Let it out.
Oh!
Take a big breath and let it all out.
So breathing like this, you see this in a lot of chiropractic videos. Chiropractors telling their patients to take a deep breath in, take a deep breath out, right? That allows the patient to relax because you get the best adjustment when the patient is relaxed. So that's why we use these different breathing techniques to help you relax before we treat you.
I want you to drop those shoulders all the way down to the ground. Let the arms just hang heavy, heavy, heavy. There you go.
Here's why she let the arms fall out or the shoulders drop down. When she's adjusting that area, when you drop your arms down off the table, that opens up the shoulder blades. So it allows a little better adjustment in the mid-back.
Time and...
Oh my God. Okay. Did not see that coming. Okay. Does that happen in the clinic? Does the patient fart after an adjustment? Absolutely. Has it happened to me being adjusted? Yes, it has. It's just sometimes you can't control it. Do I tell the patients when it happens? No. I don't know if that's worse. I don't know if that's better, but yeah, that does happen in the clinic.
I was actually expecting her to fart in my face, but I was going to take one for the team.
Okay. Overall, my first reaction is that is pretty accurate to what we see in the clinic. You know, main complaint of farting? No. But, I mean, everything she did, she checked the spine before she adjusted. She adjusted the whole spine. That's pretty common to what we see in practice. So, pretty happy, pretty impressed with Crack Addicts on TLC. I hope you guys enjoyed this reaction video. I want you to do me a favor. I want you to click subscribe to my channel. Reason being is this is meant to be educational. I want to teach you guys more about chiropractic and how it can increase your quality of life and common things that I see in the clinic. And I want to debunk some stuff that you see online about chiropractic. So click subscribe if you want to learn more. Again, I appreciate it, you guys. Have a good rest of your day.